Today on The Real Story, schools are back in session and still COVID remains a concern. And there's more data now on the Delta variant and its impact on the unvaccinated and the vaccinated. What are we seeing? We bring back Dr. Albert Ko from the Yale School of Public Health to take the temperature on COVID here in Connecticut once again. Plus, Connecticut businesses still trying to navigate through the pandemic, from the president's vaccine mandate for the public sector to the possibility of vaccine passports. A lot to talk about with the editor of the Hartford Business Journal, Greg Bordenaro. It's all today on The Real Story. Good morning, and thanks for joining us on The Real Story. I'm Jen Bernstein. Well, the push to vaccinate people continues, especially as we head into the fall with schools back in session. We know in a little over a month, the FDA could authorize Pfizer's vaccine for ages 5 to 11. But in the meantime, we're still dealing with the Delta variant and a spike in cases. We've had Dr. Albert Ko on our show every few months to get a read on where we are in this pandemic. This is an opportunity to have a longer form discussion with some context that you don't always get on television. So we're bringing him back this morning once again. Joining us, Dr. Ko from the Yale School of Public Health. Welcome back to The Real Story.
Thank you very much, Jen, and thank you for asking me to come back again.
Of course. All right, so tell me what the state of COVID is here in Connecticut. How are we looking? We know we have seen a spike in cases in the last couple of months.
Yeah, so much as with the other parts of the United States, we're experiencing this Delta wave. This is an increase in cases or a surge in cases that are due to this highly transmissible variant. This is a variant of the COVID virus that is twice as transmissible as what we've experienced in the past. And we've had increases in cases, but these increases have been far less than what we experienced, for example, in the initial surge back in early 2020 and our second surge that happened in the past winter. And I think what's really important is that we've had hospitalizations and we've had deaths, but we've had much less. And not only in comparison to what we've experienced in the past, but also what other states have experienced. We've heard these really horrifying, devastating stories from the south of the U.S., from states like Mississippi, Alabama, and Louisiana. And we've really not necessarily dodged the bullet on this, but we haven't suffered the burden that's been really crippling many other places in the United States.
What stage is the Delta variant at? We know it is going to run its course, right? So are we seeing a leveling off by any means here in Connecticut?
Yeah, so we certainly have been seeing a leveling off of cases and even maybe the beginning of a decrease on the epidemic curve. Similarly, we've had we're seeing a leveling off of the hospitalizations that we've experienced, and we've had actually very few deaths, compared to previous epidemics. So the big question is that are we really on the downslope on this? And is this going to be a steep downslope or is this going to be a drawn out one? And, and I think, we have to always be humble about our projections and the uncertainties. Certainly if we look at other countries that have gone up and down on their curves, that's happened over a course of 1 or 2 months. And I think the last time I was on this show, I kind of projected that we'd be on the downside starting in September. I hope, certainly hope that we're going to be on that. I think the one thing that we're worried about is going into the colder months. This is a virus that's transmitted when people are in enclosed indoor spaces, when they're, gatherings between people in those settings. And so I think we're going to have to see how this is going to play out as we go into the winter.
Yeah, that was a concern last year. Of course, that was also pre-vaccine. I want to take a look at the COVID metrics that the state puts out every single week, because we need to provide some context for these. I'm going to give you an example. This is this past Thursday. We have cases over 1,000. Tests. How many tests were administered in the state? 36,000. The positivity rate on Thursday, almost 3%, 2.95%. And in terms of hospitalizations, 325 people in the hospital, 237 of them, which is about 73%, not vaccinated. And every Thursday now, the state is reporting the number of deaths weekly instead of daily. And the number of deaths since last Thursday, 31 people, sadly, which seems actually kind of high. I don't know what context you have behind that. That seems higher than we've seen in the last couple of weeks.
Yeah, so Jen, let me put some of these numbers in perspective. So again, the nation, as much of the world, has been confronted by this Delta variant and the enormous surge. This is a highly transmissible virus, and we have to ask ourselves, what would we be like if we didn't have the vaccine? And all we have to do is just, look at what's happening in other parts of the country, where states have much lower vaccination rates, and looking at the devastation that's happening there. Let me take just a good example, the state of Mississippi. Well, so here in Connecticut, we're having about roughly, 3 to 5 deaths a day on average. That is still too high, but we want to compare that number to a state like Mississippi, which has a smaller population than Connecticut, and they're experiencing 50 deaths a day. So you can imagine where we would be if we didn't have vaccinations, and how bad we would be if we didn't have the tremendous work that the state and the Department of Public Health has done in rolling out vaccinations and protecting our population. Let me go back to your earlier question. I think those numbers, for many of us who are physicians and working in public health, anything greater than 1 is high for us. But let's put it in perspective. We've gone up on the curve. We're actually now leveling off, okay, and with the signs that transmission is actually decreasing here in the state. So that's all good news. And I think, again, if we compare ourselves to our neighbors in other states, and we compare ourselves to other countries, if we think about really where this all began in India, and the hundreds of thousands of people who died during that Delta surge. That's not only the cautionary tale, but it's also the tale that brings us back to, again, the game changer in all this, which is vaccinations.
Yeah, Dr. Koh, I want everyone at home to understand, too, that while we're sitting here and we're looking at statistics, these are people that we're talking about. The number of people who've died since last Thursday, 31 people, 31 of our neighbors and friends, mothers, fathers. So I want everyone at home to know that we're looking at the metrics to provide context, but of course, keeping in mind that these are people here in Connecticut who have loved ones and who are our neighbors. So I do want to just recognize that and pay attention to that. One thing that I know a lot of people focus on, and we certainly have been guilty of this too in the media, I think, is the positivity rate, right? So we have almost 3% positivity rate on Thursday, but it's just important to note when I'm looking at it too, that figure as a standalone figure can't really tell the full picture because it really depends on the amount of testing that's going on, right? So we had some 36,000 tests on last Thursday. Do you remember at the height how many tests we were doing? Because obviously you have increased testing, you could have lower positivity rate, right? And so I'm not saying to not look at that measurement, but we should just keep in mind when you hear a higher positivity rate to make sure to look a little bit further, right? What are the number of cases that were positive? How many tests were administered?
Yeah. So Jen, before answering that question, I just want to go back, and I think you really made a really important point that these are lives that we're talking about, whether there are fellow citizens, whether there are family members, whether there are friends who are getting hospitalized or dying from COVID. And again, more than one is too much. And I think we have to ask ourselves, what can we do more? And I think this is really, again, going back to the key issue, we need to vaccinate our population, and we need to leave no one behind. We have to make sure that vaccination is a weapon or a tool of social justice rather than a tool of social injustice. And that's vaccinating all segments of our population here in Connecticut. So let me get back to your question about test positivity. You're absolutely right about what is test positivity, raising the question whether test positivity is really the right metric. Just to go, review what test positivity means. That's the number of positive tests on all the tests that are done. So if we're having decreases in the number of tests, the test positivity artificially goes up. And that was the case that happened if we go back before we had vaccines, where we had to test everybody, and we had to test widely, and we had to test populations or vulnerable populations like those in the nursing home with frequent tests every week or every 2 weeks in order to protect them, in order to identify people early, have them get the care they deserve, and also to prevent transmission in these high-risk settings. So we were testing at that point. If we go back a year from now, we're doing 40,000 tests a day, and at the peak, really to clamp down transmission, and this is all before vaccination. Now, the game changer again was vaccination. And so we didn't need to test widely, do mass screening of people who didn't have symptoms, who are asymptomatic. And so we're now testing at this point about 20,000 people a day. That's actually quite a good number. And if we compare ourselves to, let's say, other states in the United States, we're doing a much better job in testing, and we're testing widely, and particularly in the community. So the key metric here is now not test positivity if we want to compare over time. And that's because the state has been doing a great job in testing. And not only the state, but the healthcare systems have been doing a great job in access to testing. But the key metric now is the number of cases that we have.
Okay, interesting. That makes sense. Question for you. I was looking at this too. It looks like they don't separate the PCR and the rapid tests. And we know that rapid tests, I don't know what the accuracy level is. Is that problematic? Is that something that they should look at? Because if you have higher number of rapid tests, I know that they can come back with false negatives. Does that kind of cause the numbers to be skewed at points too?
Yeah, and so Jen, I think the key issue is, why do we do testing? And we do testing so we can identify people so they can get good medical care, medical treatment. We also do testing so we can start isolating people and preventing spread, in our communities. And for that reason, there's really, a positive test for a rapid antigen test is just as good as a positive test for PCR. I think the problem we have to understand is that rapid tests, although, if you have a positive, it's a real positive, what we worry about is the sensitivity is lower than the gold standard PCR test. So when you have a negative, and let's say you're symptomatic or you've been exposed to somebody for COVID, our recommendations is if your rapid test is positive, that means that you have got COVID. But if it's negative, you should go out and get a PCR test.
Yes, I know. When I have had to go, if I had a cold, I have not had COVID and I am vaccinated, but when I, to be cautious, have gone and they say to get both if you were trying to do the rapid quickly too, which I've gotten both. Okay, let's talk about the hospitalizations, because I know, the state puts out that 73% of the people on Thursday who are in ICUs are unvaccinated, which is a large number. And that's, what you're saying, the push to get people vaccinated. But I'm looking at the other number. There are 88 people who are in ICUs who are vaccinated. So, and I look at that number and I say, who is making up that? Do they have other health complications? How concerned should we be? Because 27% of people in ICUs do have, are serious enough to be hospitalized. So tell me what you guys are seeing and hearing on that front.
Okay, so Jen, that's a really important question. And it's a question about how to interpret numbers and which numbers are the right numbers or the best numbers. So I think this is the consensus of all the public health experts. It's really not the proportion of the fully vaccinated patients or among all all cases in the ICU or in the hospitals that's important. It's actually the difference in the rate or the risk. And that's why, to give you a good example, here in Connecticut, we live in a state where the large majority of people are vaccinated. The vaccine is not 100% effective. It's highly effective, above 90%, but it's not 100%. So because we have a lot of people vaccinated and a lot of our elderly population, we have over 85% of our elderly population vaccinated, but those are also the people who are at risk of getting severe disease. You're going to have that skew to having more people who are vaccinated, or a higher proportion of people who are vaccinated among all the people in the ICUs and hospitalizations, if you compare us to, Mississippi or Louisiana or Florida or Texas. But that is misleading. And what's really the bottom line is, and the important is the difference between the risk between people who are vaccinated and unvaccinated in getting COVID, getting hospitalized, and dying of COVID. In our state here in Connecticut, if you're vaccinated, you have more than a 5-time less likely chance of getting sick from COVID. If you're vaccinated, against COVID, you have a greater than 20 times less likely risk of dying from COVID. So that's the key indicator. It's not necessarily the proportion of people who are in our ICUs who are vaccinated or unvaccinated. It's really the risk, the differences in rates between those people who are unvaccinated and those people who are vaccinated. And just, bottom line, if you're not vaccinated, you have over 20 times chance of dying from COVID than if you got the vaccine.
Okay, interesting perspective when you're saying to look at these numbers, and that's why we're breaking them down. So many of us here in Connecticut look at those numbers on a daily basis, and so to go through them and really get some context is key and really informative. Dr. Ko, always good to have you on. I only got through about a third of the questions that I had down, so maybe you'll come on again next week and we can continue this conversation. So I'll bug you after the show to see when we can schedule you again for more of this.
Jen, it's always a pleasure, and thank you again for the opportunity to talk.
All right, Dr. Ko, thank you. Coming up, President Joe Biden's vaccine mandate creating a lot of questions for Connecticut businesses, plus the possibility of a vaccine passport system in our state. We're going to chat with Greg Borninaro, the editor of the Hartford Business Journal, ahead.